Hi, I'm Jake. I'm going to be your nurse today.
Hi.
First, could I start off with your name and date of birth, please?
Emily Robson, 12/30 of '03.
Awesome. And then, secondly, you would check her wristband for your second patient identifier. Today, I'm going to be completing a physical assessment. Is that okay right now?
Yep.
Awesome. So we're going to do a few different things here. First, can I just start off by asking you a few questions? Like, you know what day it is today?
The 6th,
And how about the month?
April.
Awesome. When you walk, are you unsteady or are you able to walk normally,
Normally.
pretty normally?
Mhm.
Awesome. Alright, so first I'm just going to do a couple things here. I'm going to turn my pen light on. If you could just look forward, I'm just going to check your eyes quick. And when you do this, if possible, you'd want to dim the lights. And your other eye here. Perfect. If I could just have you stay at the tip of my pen here, I'm going to be moving it in a few different directions. And stay looking at it, and go far and come close to your nose. Awesome. If I could just get your hands here, if you can squeeze on my fingers with both hands. Thank you. And we're going to move to your feet here. And put your feet up straight. And I want you to push on my hands as hard as you can with your feet. Thank you. And now you're going to want to pull it toward your body with your feet. Awesome. Perfect. A few more questions for you. Do you have any chest pain?
No.
What about, are you taking any medications?
No.
No medications either. Alright, I'm going to check a few pulse points here, starting with your temporal. And now on your neck for your carotid. And if I could see your arm, please, for your brachial. This one. And we'll move to your wrists for the radial. And this one. Then to your femoral. Other side. Awesome. Now I'm just going to check your popliteal, which is under your knee. The other one. Now we're just going to move down to the foot and check the pedal pulse. And finally your posterior tib. And when you're down here, you're going to want to check for edema in the feet and ankles, along with capillary refill time in the toenails, making sure it's less than 3 seconds. And you're also going to want to check in the fingernails, making sure that's less than 3 seconds as well. Now we're just going to do a little bit of listening here to your heart. And you're going to want to start in the second intercostal space, and starting with the apical. And then you're going to move over to check the pulmonic. And then to the third intercostal space for the herbs. Fourth intercostal space for the tricuspid. Then fifth intercostal space at the midclavicular line for the mitral. And here you're just going to want to make sure you can hear the S1 and S2 sounds. Your S1 sound is going to be your tricuspid and your mitral valve closing, and your S2 dub sound is going to be your apical and your pulmonic closing. Now we're just going to do a little bit of listening to your lungs. Do you have any shortness of breath on the daily basis?
No.
No? What about when you walk to your mailbox and back? Do you experience a shortness of breath?
No.
What about no chest pain or anything to go along with that? No? Alright, we're just going to start up here on your front side. And we're going to start right below the clavicle. If you could just take some deep breaths for me here. And here you're going to want to be listening to make sure there's no wheezing or crackling. Now we're going to work on your back here. Same thing, deep breaths. Thank you. And for that, you're just going to want to work on both sides of the spinal column on the back, and on the front side, you're just going to want to go on either side of the sternum. All right, I got a few more questions here for you. When you, like on a daily basis, are you experiencing bowel movements like every day, every other day?
Every day.
Every day. And then what about urination? Are you urinating multiple times a day, or?
Five or so.
5 or so times a day, good. And then do you notice the color? Is it a dark gold, or is it more of like a palish light yellow?
Yeah, it's pale.
Yeah. And then how about your appetite? Are you eating normally?
Yep.
Nice. And no painful urination or anything like that?
No.
No? Do you have any abdominal pain?
No.
No? Okay, if you could just lay back down here for me, we're just going to check a few things on your abdomen. First, you're going to want to note the size and shape of the abdomen, make sure it's not concave or distended or anything like that. After you note that, you're going to want to do some listening. So we're going to do a little bit of listening here, starting in the right lower quadrant. And you're going to want to listen for bowel sounds here. You're going to want to listen 1 minute in every quadrant. Awesome, and then after that, we're just going to do a little bit of palpating, which means pushing on your abdomen. And you're just going to want to make sure it's soft, not firm or distended. And after you check that, you're going to want to make sure the bladder is not distended as well, which it is not. Awesome. Well, that should conclude my physical assessment. Thank you very much, and have a good day.